The next time you're performing or coaching a side plank, ask yourself or your patients, where am I feeling it? A lot of times, side planks are done and the obliques aren't optimized. Usually, other things take over. So, just like pilots do, we need to provide a checklist. A checklist is going to increase the chance for success and also use the right things for success. So, here is the best go to side plank checklist. Go down on your side or have your patient go on their side and instruct them to get into a really bad position by dropping the shoulder towards the ear. Step number one, push out away from the ear. So the shoulder should be far from the ear. Step number two, retract the scapula by bringing that shoulder back. So the shoulder blade goes towards the spine, not turning the body. A lot of times, patients, when you ask to retract, they will turn. So shoulder blade towards the spine. The point of this is to load the shoulder blade so the shoulder blade is taking stability and not the anterior shoulder and or the neck. Step number three, notice in this position my left rib cage is down. In this position, the abs are off and the right side is actually on. We want to reverse that. Bring the rib cage up. So we're putting the ribs in a position, and right there they start shaking. We're putting the ribs in a position that they actually now are ready to work compared to down here. Finally, our fourth and final step is to make sure we lift from the ribs and not the hips. Most people just pop up for their side plank. What we need to do is imagine we're pushing from the ribs and the ribs slowly lift the whole hip. This will ensure that the ribs stay higher than the hips. It will also ensure that they don't drop, aka you start to feel the abs. In this position, I can feel my abs working. When I come down, I'm thinking hips come down first, keep the ribs high. And as I go up, the rib cage gets me up. I'm not just popping the hip up. So give this checklist a shot the next time you are performing a side plank.